The 2019 novel coronavirus is a global health emergency.
We must all act together now to limit further spread.
Since they began using the designation in 2005, the World Health Organization has declared global health emergencies only 5 times before. The first case was reported in the Chinese city of Wuhan on New Year's Eve. Now, over 30,000 people in at least 26 countries have contracted the coronavirus. The vast majority of confirmed cases are in mainland China, where the numbers continue to skyrocket, and where more than 600 people have died as a result. Border closings, suspended flights, a citywide evacuation and quarantine, it's scary stuff. So what is it we're really talking about when we talk about the coronavirus? And what can we do to protect ourselves?
Hi everyone, today we will discuss about the rules of artificial intelligence AI in issues that are related to the COVID-19, which is coronavirus disease. So I feel like we need a superhuman power to help ease the global pandemic such as COVID-19 before it kills millions of lives out there. And artificial intelligence may have been hyped, but in medicine it's proven a track record, for example SARS. So the question here is whether the researchers or health professionals can use the machine learning and artificial intelligence to fight against the COVID-19 and finding the cure. And there are many roles of AI throughout the COVID-19 pandemic. The first point is AI helps to identify, track, and forecast an outbreak. The better we can track the virus, the better we can fight it. By analyzing news reports, documents of governments, and social media platforms, I could say that the artificial intelligence can track an outbreak. And tracking infectious disease risk by using artificial intelligence is exactly a service that provided by the Canadian company, which is Blue Dot. Blue Dot is an artificial company that located in Toronto uses machine to monitor the outbreak. They are among the clusters of the high-tech firm to track the COVID-19 for better understanding and to fight combat. In fact, the Blue Dot's artificial intelligence have one of the threat several days before the Centre of Disease Control, the CDC, and the WHO, the World Health Organization, issued this coronavirus to the public. Based on the MIT Technology Review, they said that the Blue Dot wasn't alone. They uses an automated machine which is called HealthMap at Boston Children's Hospital, also called the first sign. So that AI could track an outbreak is something that's pretty amazing because it gives us the early warnings and save lives is what that matters. Another thing that inspired me is the black box, which is also called the COVID black box technology, which is a little camera close to where the healthcare professionals putting on their gear and taking off their gear, and it will automatically blur their faces. So there will be unbiased assessment from the individual as to whether the people are doing the procedures correctly or not. And the point of going in and tell them how to do it better. And it uses video technology, AI technology, and data science, and etc. to advise the people who mostly exposed, which is the healthcare professionals, to be more careful and to take care of themselves better from this virus.
Surgery is now being recorded in some Long Island operating rooms in a high-tech effort to improve safety.
It's similar to black box technology used in airplanes. CBS News' Karen Gussoff shows us how it works.
They have them for trains, planes, and automobiles, and now Black box technology coming to a hospital near you, overhead while you're under the knife. Long Island Jewish Medical Center, the first in the U.S. to install the OR black box in 2 operating rooms.
There is no question that this is going to improve the quality for patients.
Dr. Louis Cavusi welcomes the technology in his OR. Cameras and microphones record. The data then transmitted to a Canadian company that analyzes everything from sterile technique to distractions.
Who should or should not be coming in and out of the operating room? Should telephone calls come in? Should there be music in the operating room?
And through algorithms, it can predict a mistake and alert a surgeon.
We all think as surgeons we are perfect, but in reality we aren't. And this is an opportunity to use artificial intelligence to analyze what's going on in the operating room.
The founder, a surgeon himself, says it's like professional coaching.
The reality is, as long as there are humans, there will be errors. We want to create a system that makes it very difficult to make an error.
Unlike black boxes in transportation, it will not be used to assign blame. Northwell's chief quality officer says it's used to improve systems, not to punish individuals. It's protected from subpoena in New York State as a quality control project. Patients are not identified.
The data is de-identified. They blur out the pictures of the physicians and the nurses and even garble the voices a little if we ever look at a video recording, so nobody really knows which case was whose.
But like the airline industry, it's reviewed even if there is no accident.
Thankfully, most things don't go wrong that affect the patient, but it's the near misses we want to know.
The plan is to install more of these black boxes in hospitals throughout the Northwell healthcare system. The more cases, the more data, say officials here, the more quality control and improvement. In New Hyde Park, Long Island, Carolyn Gussoff, CBS 2 News.
The technology already in use in 10 hospitals in Canada and Western Europe.
And yeah, I'm sure that in global pandemics such as COVID-19, technology, AI, data science have been helped critically help the societies effectively to deal with an outbreak. And Sasikala, what do you think about the roles of AI in issues that are related to the COVID?
Okay, I would agree with your point, Jivita, but I would like to add another that the AI is playing their roles in issues related to COVID-19, which is by immediate diagnosis. Immediate diagnosis implies that response measures together with quarantine can be utilized rapidly to control further spread of the infection. An obstacle to rapid diagnosis is the general deficiency of clinical expertise required to interpret diagnostic outcomes because of the quantity of cases. AI has stepped forward diagnostic time within the COVID-19 crisis through technologies such as that developed by Linking Med, a Beijing-based oncology data platform and medical data analysis company. Pneumonia, a common complication of COVID-19 infection, can now be diagnosed from analysis of a CT scan in less than 60 seconds with accuracy as high as 92% and a recall rate of 97% on test data sets. This turned into made possible by an open source AI model that analyzes CT images and not only identify lesions, but also quantify in terms of number, volume, and proportion. That's all based on my opinion. And Kanisha, what do you think about the roles of AI in issues related to COVID-19?
Yeah, I agree with both of you. Today, AI technologies and tools play a key role in every aspect of the COVID-19 crisis, in understanding the virus and accelerating medical research on drugs and treatments, detecting and diagnosing the virus and predicting its evolution, assisting in preventing or slowing the virus spread through surveillance and contact tracing, responding to the health crisis through personalized information and learning, and also monitoring the recovery and improving.
Okay, now we will discuss and brainstorm something about the AI-based existing solution for COVID-19. And something that I found fascinating is chatbot. As we know, the chatbot have been existing here a long time ago. The first chatbot was developed by MIT professor Joseph Weizenbaum in 1960s. It was called ELIZA. So here we can see the evolution of the chatbots is something that day by day rapidly it's growing. As COVID-19 has spread globally and as we are practicing a social distancing to flatten the curve, it is technologies like chatbots are coming to rescue, because now more than we ever need to stay closer and connected to our families, to a nearest grocery shop, take our join, and to the information from the local governments. Chatbots, the main purpose is to share information from one person to another person. Tencent operates WeChat, and people can access free online health consultation services through chatbot. And chatbots also have been essential communication tool for the tourism and travel industry to keep the travelers up to date with the travel information, something regarding the latest travel procedures and latest travel disruptions, and sort of. Here, some of it feels that chatbots are making some difference, which is the first point is government healthcare organization. Why? Because chatbots are perfect for when users for appearing on government website for location-based information or generate COVID-19 related information, especially since they cannot talk to the real person, and this information is crucially to be received right away 24/7. They are asking questions like how does the virus spread, how does the test done, and what are the lockdown location is, and how long the shelter in place order is, etc., etc., and how the chatbots really works. World Health Organization (WHO) is one of the authoritative and trusted source of information on the pandemic, and there are country-specific authoritative sources such as Center for Disease Control, the CDC, and the Prevention in United States. These sources have tons of answer for the question that they're asking regarding this coronavirus, and healthcare businesses to the frequently asked. The healthcare businesses can utilize the information that given by the CDC from the trusted source to create chatbots, the messenger bots, and even the voice bots for their custom needs.
As COVID-19 affects communities around the world, communication systems have been stretched to capacity. People seeking basic information around resources, testing, symptoms, and treatment can often struggle finding it. When communication methods lag, those who need real help can't get access to it. In these cases, chatbots can be an invaluable tool that provide help responding to potentially hundreds of thousands of messages each day. To address immediate needs around crisis communication, our team built a chatbot that users can access on a website. The solution connects to Slack and a voice-enabled chatbot that is connected to Node-RED. The chatbot can even retrieve COVID-19 news through Watson Discovery and query-trusted data sources for COVID-19 infection statistics. This starter kit uses Watson Assistant and shows developers how basic workflows would connect the user and the back-end technology. Those who take this starter kit forward will have a strong foundation to incorporate publicly available data.
Chatbots make difference in such as volunteering, retail, restaurant, and financial health and well-being. And that's the thing that I found interesting in the AI-based existing solution. And Sasikala, what about you?
My point based on the existing AI-based solutions for COVID-19 are intelligent drones and robots. The public deployment of drones and robots has been improved because of the strict social distancing measures required to incorporate the virus unfold. instance, some drones are utilized to follow individuals who are not using face masks out in the public, while others are utilized to broadcast information to bigger crowds and furthermore sanitize or disinfect public spaces. Micro Multicopter, a Shenzhen-based technology company, has helped with reducing the virus transmission risk concerned with citywide transport of medical samples and quarantine materials through the sending of their drones. Patient care without danger to healthcare workers has likewise benefited as robots are utilized for food and medication shipping or delivery. The function of room cleaning and sterilization of isolation wards has also been filled by robots. Catering industry-focused Voodoo technology have prolonged their reach to the healthcare zone with the aid of deploying their robots in more than 40 hospitals for those purposes. So Kanisha, could you tell us any other existing AI-based solutions for COVID-19?
Sure. Limiting contagion is a priority in all countries, and AI applications are helping prevent the virus spread. A number of countries are using population surveillance to monitor COVID-19 cases. For example, in Korea, algorithms use geolocation data, surveillance camera footage, and credit card records to trace coronavirus patients. China also assigns a risk level color code, which is red, yellow, or green, to each person, indicating contagion risk using cell phone software. While machine learning models use travel, payment, and communications data to predict the location of the next outbreak and inform border checks, search engines, and social media also are helping to track the disease in real time. Moreover, many countries including Austria, China, Israel, Poland, Singapore, and also Korea have set up a contact tracing system to identify possible infection routes. In Israel, for example, geolocation data was used to identify people coming into close contact with known virus carriers and send them text messages directing them to isolate themselves immediately.
That was really a fruitful conversation regarding the AI-based solution, existing AI-based solutions.
When a patient is diagnosed with an infectious disease like COVID-19, an important step in slowing the transmission of the disease is contact tracing. Contact tracing seeks to identify the people who have had close contact with the infected individual, and who therefore may be infected themselves. This targeted strategy reduces the need for stay-at-home periods. However, manual contact tracing is subject to a person's ability to recall everyone they have come in contact with over a 2-week period. There is need for an automated, privacy-preserving contact tracing system. MIT is developing one such system. Cell phones are constantly advertising their presence using Bluetooth. These advertisements, which we call chirps, can be anonymous and contain no location data or personally identifiable information. Every phone stores a list of all the chirps that it has sent and all the chirps it has overheard from nearby phones within arm's reach. The MIT system utilizes these lists to enable contact tracing for people diagnosed with COVID-19. This system not only identifies contacts, it also estimates the distance between individuals, as well as the amount of time they spent in close proximity to each other. When a person is diagnosed with COVID-19, public health professionals would coordinate with the patient to upload the list of chirps sent out by their phone to a public database. Meanwhile, people who have not been diagnosed can have their phones do a daily scan of the public database to see if their phones have overheard any of the chirps used by people later diagnosed with COVID-19. This indicates that they were in close, prolonged contact with that anonymous individual. Depending on the circumstances of contact, they may be referred to the public health authorities, who may recommend varying courses of action, including symptom watch, testing, and self-quarantine.
there are lots of existing AI-based solutions for COVID-19, still I would like to suggest a new solution that employs AI techniques where AI can construct a smart platform for automated tracking and prediction of the spread of this virus. A neural network can likewise be developed or evolved to extract the visual functions of this disease. And this will help in legitimate monitoring and treatment of the affected peoples, and maybe it also has the ability of giving day-to-day updates of the patients, and furthermore to provide solutions to be accompanied in COVID-19 pandemic. And this is a solution that I would like to suggest. Thank you.
So, in conclusion, what we like to say is artificial intelligence is an upcoming and useful tool to identify early infections due to coronavirus and also helps in monitoring the condition of the infected patients. It can significantly improve treatment consistency and decision making by developing useful algorithms. AI is not only helpful in the treatment of COVID-19 infected patients, but also for their proper health monitoring. It can track the crisis of COVID-19 at different scales, such as medical, molecular, and epidemiological applications. It is also helpful to facilitate the research on the virus using analyzing the available data. AI can help in developing proper treatment regimens, prevention strategies, drug, vaccine development. Thank you.